Welcome. Today, we'll walk you through everything you need to know about preparing for a free T4 test. This blood test is commonly used to assess thyroid function and can help diagnose conditions like hyperthyroidism or hypothyroidism. Understanding the preparation process is important to ensure accurate results. In this video, we'll cover what the test is, why it's ordered, and step-by-step guidance on how to get ready. Let's start by understanding what a free T4 test measures and why your doctor might recommend it. Free T4, or free thyroxine, is a hormone produced by your thyroid gland. Unlike total T4, free T4 measures the hormone that is not bound to proteins in your blood, making it available to your body's tissues. This distinction is important because only free T4 is active and can affect your metabolism and energy levels. Doctors often order this test to get a clearer picture of your thyroid's function, especially if you have symptoms like fatigue, weight changes, or mood swings. Doctors may order a free T4 test if you're experiencing symptoms that suggest a thyroid problem, such as unexplained weight gain or loss, changes in heart rate, or persistent tiredness. It's also used to monitor people already diagnosed with thyroid disorders or those taking thyroid medication. By measuring free T4, your healthcare provider can better understand how your thyroid is functioning and adjust your treatment plan if necessary. Before your test, it's important to talk to your doctor about any medications you're taking, including over-the-counter drugs, supplements, and herbal remedies. Some substances can interfere with thyroid hormone levels and may affect your test results. Your doctor will let you know if you need to stop or adjust any medications before the test. Always follow your doctor's instructions carefully to ensure the most accurate results. Certain medications, such as thyroid hormone replacements, steroids, or birth control pills, can influence your free T4 levels. Your doctor may advise you to temporarily stop taking some of these medications before your blood draw. However, do not make any changes on your own. Always wait for your healthcare provider's guidance. This step is crucial for getting a true picture of your thyroid function. For most free T4 tests, fasting is not required. You can usually eat and drink as normal before your appointment. However, some labs or doctors may recommend fasting, especially if other blood tests are being done at the same time. Always confirm with your healthcare provider or the laboratory if you need to fast, just to be sure. The timing of your free T4 test can sometimes matter, especially if you take thyroid medication. Your doctor may recommend having your blood drawn at a specific time of day, such as before taking your morning dose. This helps ensure that the results accurately reflect your baseline hormone levels. Be sure to clarify the timing with your healthcare provider. Staying hydrated before your blood test can make the process easier. Drinking water helps your veins become more visible and accessible, which can make the blood draw smoother and less uncomfortable. However, avoid excessive caffeine or sugary drinks before your appointment, as these can sometimes affect your overall well-being. On the day of your test, wear clothing with sleeves that can be easily rolled up or removed. This makes it easier for the healthcare professional to access your arm for the blood draw. Comfortable, loose-fitting clothes are always a good choice for medical appointments, helping you feel at ease throughout the process. Plan to arrive at the laboratory or clinic a few minutes early. This gives you time to check in, complete any necessary paperwork, and relax before your blood draw. Arriving early can also help reduce stress, ensuring you're calm and ready for the procedure. Don't forget to bring a valid form of identification, such as a driver's license or health insurance card, to your appointment. Most labs require ID to verify your identity and match you with the correct test order. Having your paperwork ready can help the process go smoothly. When you arrive, let the staff know if you have any special circumstances, such as a history of fainting during blood draws or difficulty finding veins. This information helps them prepare and provide extra support if needed, making your experience more comfortable. During the blood draw, a healthcare professional will clean your skin, insert a small needle into a vein in your arm, and collect a blood sample. The process is usually quick and only mildly uncomfortable. Try to relax and breathe normally. If you feel nervous, let the technician know they're there to help. Once your blood has been collected, the technician will apply a small bandage to your arm. You may be asked to apply gentle pressure for a minute to prevent bruising. Most people can resume normal activities right away, but if you feel lightheaded, sit for a few minutes before leaving. It's normal to experience minor side effects after a blood draw, such as slight bruising, tenderness, or a small bump at the puncture site. These symptoms usually resolve within a day or two. If you notice excessive bleeding, swelling, or signs of infection, contact your healthcare provider promptly. Free T4 test results are typically available within a few days. Your healthcare provider will contact you to discuss the findings and what they mean for your health. If you haven't heard back within a week, it's okay to reach out to the clinic for an update. Your doctor will interpret your free T4 levels in the context of your symptoms and other test results. High free T4 may indicate hyperthyroidism, while low levels can suggest hypothyroidism. Sometimes, further testing is needed to confirm a diagnosis or adjust your treatment plan. Depending on your results, your doctor may schedule a follow-up appointment to discuss next steps. This could include starting or adjusting medication, ordering additional tests, or simply monitoring your thyroid function over time. Be sure to keep all follow-up appointments for the best care. Open communication with your healthcare provider is key. If you have questions about your results or symptoms, don't hesitate to ask. Your doctor can provide guidance, reassurance, and help you understand what your free T4 levels mean for your overall health. Your lifestyle can impact your thyroid health. Eating a balanced diet, managing stress, and getting regular exercise all support healthy thyroid function. If you have a thyroid disorder, your doctor may recommend specific lifestyle changes to help manage your condition. Certain nutrients, such as iodine, selenium, and zinc, are important for thyroid function. While you don't need to change your diet for the test itself, maintaining good nutrition can support your thyroid in the long term. If you have dietary restrictions or concerns, talk to your doctor or a registered dietitian. If you take supplements, especially those containing biotin or high doses of vitamins, let your doctor know. Some supplements can interfere with thyroid tests, leading to inaccurate results. Your doctor may advise you to stop certain supplements before your blood draw. Alcohol and smoking can both impact your thyroid function and potentially influence test results. While you don't need to abstain for the test, it's wise to avoid excessive alcohol or smoking before your appointment. Discuss any concerns with your healthcare provider for personalized advice. Feeling anxious about blood tests is common. Practice deep breathing or mindfulness techniques to help calm your nerves before and during the procedure. Bringing a friend or listening to music can also help you feel more at ease. If your child needs a free T4 test, preparation is similar but may require extra reassurance. Explain the process in simple terms and bring a favorite toy or comfort item to the appointment. Pediatric staff are skilled at making children feel comfortable during blood draws. Pregnant women may need free T4 testing as thyroid function can change during pregnancy. If you're pregnant, let your healthcare provider know, as reference ranges and preparation steps may differ. Your doctor will guide you on any special instructions for accurate results. Older adults may have unique considerations when preparing for a free T4 test. They might be taking multiple medications or have mobility issues. It's important to review all medications with the doctor and arrange for assistance getting to and from the appointment if needed. If you have a chronic illness, such as diabetes or kidney disease, let your healthcare provider know before your free T4 test. Some conditions and their treatments can affect thyroid hormone levels, so your doctor may need to adjust your preparation or interpret your results differently. If you're traveling around the time of your test, plan ahead to ensure you can attend your appointment and follow any preparation instructions. Bring a list of your medications and supplements, especially if you'll be visiting a new clinic or lab. If English is not your first language or you have accessibility needs, let the clinic know in advance. Many facilities can provide translation services or accommodations to ensure you understand instructions and feel comfortable throughout the process. Check with your insurance provider to confirm coverage for the free T4 test. Some plans may require pre-authorization or a referral. Understanding your coverage and any out-of-pocket costs ahead of time can help you avoid surprises. Before your appointment, confirm the location and hours of the laboratory or clinic. Some labs require appointments, while others accept walk-ins. Knowing the details in advance helps you plan your visit and avoid unnecessary delays. Taking a few moments to mentally prepare can make your experience smoother. Remind yourself that the test is quick and routine, and focus on the benefits of understanding your thyroid health. Positive thinking can help reduce anxiety and make the process more comfortable. Avoid strenuous exercise, excessive caffeine, or large meals right before your test, as these can sometimes affect your overall well-being or make the blood draw more difficult. Stick to your normal routine unless your doctor gives you specific instructions. If you feel nervous or have a history of fainting, consider bringing a friend or family member to your appointment. Having support can make you feel more comfortable and provide reassurance during the process. Sometimes, labs can be busy, and you may experience a wait. Bring something to read or listen to, and try to stay patient. If you have time constraints, let the staff know when you check in so they can do their best to accommodate you. If you know you have small or hard-to-find veins, mention this to the technician. Drinking water beforehand can help, and experienced staff may use special techniques or equipment to make the process easier. If you have allergies to latex, adhesives, or antiseptics, inform the staff before your blood draw. They can use alternative materials to ensure your safety and comfort during the procedure. Maintain a personal health record with your test dates, results, and any changes in medication. This can help you and your doctor track your thyroid health over time and make informed decisions about your care. Consider using digital health tools or apps to remind you of appointments, track symptoms, and store your test results. These tools can make managing your thyroid health more convenient and organized. Lab reports can be confusing, with lots of numbers and medical terms. Ask your doctor to explain your results in simple language, and don't hesitate to request a printed copy for your records. Your medical information is private. Labs and clinics follow strict rules to protect your data. If you have concerns about privacy, ask how your information is stored and who can access your results. If you miss your scheduled free T4 test, contact your healthcare provider or the lab as soon as possible to reschedule. Timely testing is important for accurate diagnosis and management, so try to keep your appointments whenever possible. To prepare for a free T4 test, review your medications with your doctor, follow any specific instructions, stay hydrated, and arrive prepared. Remember to bring your ID, wear comfortable clothing, and communicate any concerns to the staff. These simple steps help ensure accurate results and a smooth experience. Preparing for a free T4 test is straightforward when you know what to expect. By following your doctor's advice and taking a few simple steps, you can help ensure your results are accurate and your experience is positive. Thanks for watching, and take care of your thyroid health.